I think you would have come to this video seeing the title. No, doctor is not a mechanic. No, what is the comparison? We also think doctor is not a mechanic. No, there are some similarities and differences. That's why I have put this title. I'll explain through this video. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, health related explanations are provided via short, simple videos which are released every week. If you want to see such videos, kindly subscribe to this channel and also press the bell icon to get instant notifications whenever new content is released in this channel. This week's video is doctor is not a mechanic. If I go on to add, doctor is neither a detective. Doctor is not a mechanic, neither a detective. Why I am comparing these two? Sometimes, what a mechanic or an engineer does and what the doctor does looks similar. There is a problem in something, a machine or a body. The doctor, the mechanic or the engineer tries to identify the problem and gives the remedy. But in truest sense, doctor is not a mechanic. Why? Because in a machine, you can disassemble and see. But in a body, you can't do that. You have to pick up on subtle signs and symptoms. And the machine will behave in the same way every time if you give the remedy or do the correction. But body, the biological being it is, will not respond in the same way for the same problem every time. So that's why we say doctor is not a mechanic. Why did I say doctor is not a detective? Who considers doctor as a detective? Most of the parents or the patients, when they come, they give half information. They say, I have this problem. Okay, what else? You identify. No, what did happen? You identify. So, doctor is not a detective. You need to give full information. Full relevant information. What is relevant and what is irrelevant? Sometimes patient start their history. They come to the doctor and start saying, 3 days ago, I went to this my in-laws house, whom I don't like. So they have presumed that whatever problem they have is because of that unlikable in-law. So they start their history from there. No, we don't want your presumptions or assumptions. What we want is what you are going through, your symptoms and signs. That's the most important asset, information which you can provide to the doctor. All the information, all the suffering which you are having should be conveyed to the doctor in a chronological, that is in a time bound way. So 3 days ago I started having running nose. 2 days ago I started having cough. From yesterday I am having fever. Even more important, when you say about comparing machine and a body is, whenever a machine goes kaput, you give an alarm. Those alarms are the symptoms which you bring, like fever. Fever is a common alarm. But most of the modern machines also display error codes. Your ACs or washing machines will also supply error codes which help the mechanic or the engineer in correctly identifying the problem. Body also has error codes. Similarly, the body also has associated symptoms. Whenever you have fever, you also have knee pain, pain around the eyes, headache. No, these are the error codes. These give vital, important clues. So it is vital, it is important not to miss these associated symptoms. No, this information should be essentially conveyed to the doctor so that he is able to correctly diagnose and treat you. Even though I have compared machine and the body similar, what is difference is the response in treatment. So every time the machine will respond in a predictable way, but the body may respond differently. You have to understand, for the same set of symptoms and signs, the reasons might be too different and the treatments might be different. That's why sometimes for the same set of signs and symptoms, we employ the same treatment. We redo the treatment given by the doctor in the previous month or 3 months ago, or to our neighbor or friend, but we don't succeed because the reasons are different. The same set of signs and symptoms might be caused by two different reasons. The treatment might be too different. So that's what we have to understand between this comparison of doctor, an engineer, the body and the machine. So we have to understand, in biology, not every disease has the same treatment, and not every treatment will respond or will give cure to the same person in the same way. So that is not possible. So we have to understand. That's why I have made this short video about doctor not being a mechanic, neither being a mechanic nor being a detective. Always give relevant information to the doctor so that we might be benefited by getting the disease diagnosed correctly and getting it treated correctly. Hopefully this video was of use to you. If you consider this video useful, kindly share it among your friends and relatives. If you want to see such videos, kindly subscribe to this channel. Till we meet again. Bye.